So the IV formulation of Ganaxalone for the treatment of status epilepticus. There's new data. Ganaxalone is a drug that's been in development in oral formulation. We're now developing and moving forward an IV formulation of Ganaxalone for the treatment of status epilepticus. Status is a form of epilepsy where the patients are typically unconscious or not responsive, so the only treatment is an IV formulation. The advantage of Ganaxalone is that we can treat with an IV formulation, but there's an oral form. We can then convert them to an oral form upon recovery. Ganaxalone is a GABA-A positive allosteric modulator. It's similar to benzodiazepines in that it affects synaptic GABA-A receptors, but also, unlike benzodiazepines, it affects extrasynaptic GABA-A receptors. And that's a true benefit over the benzodiazepine class of compounds. So the preclinical data that we've generated and that we're presenting at this meeting, it reverses the seizure. So after the seizure formation, the experimental animals we've tested, the animals are in full seizure, and we administer Ganaxalone and it reverses the seizure, and they recover from that seizure. So the preclinical end is pretty much completed. We're very comfortable with the results we're seeing. These animal models are translatable to what's seen in the humans. So compounds that work in these preclinical animal models typically work in humans. So we're comfortable with the preclinical data to support a clinical trial with Ganaxalone. There's other treatments for status epilepticus. The benzodiazepines I mentioned, they're partially effective, and if you wait too long, they don't become effective. It becomes a refractory form of status epilepticus. Other treatments include general anesthetics. So these patients, they put them into almost a coma state with these general anesthetics. This compound, Ganaxalone, fits in between those. It's better than benzodiazepines, but it doesn't put them into a full coma state, a full anesthetic state. It's a full reversal of EEG seizure events. So these rodents, these experimental animals, are put into seizure with an experimental compound called pilocarpine. It induces a seizure response that's very similar to what's seen in humans. We put them in the seizure response, we administer Ganaxalone, and it reverses that seizure response as measured by electrophysiological measurements. But we've also done behavioral measurements. So these experimental animals, they go into convulsion, and it reverses those convulsions and promotes survival of these animals. So there's multiple readouts on the experimental animal side that point to a very positive effect of Ganaxalone in status epilepticus.